Hiya. What is vitamin D deficiency? What are the red flags or the worrying signs of vitamin D deficiency? What are the common signs and symptoms of vitamin D deficiency? How does one get it? Why does one get it? Are there ways to treat this deficiency? Are there ways to prevent vitamin D deficiency? My name is Dr. Avril Watts. I am a clinician and a scientist by training. In today's video, let's discuss about these questions in more detail. Let's go. What is vitamin D deficiency? What are the red flags and what are the worrying signs which we should be aware of if vitamin D deficiency starts? Vitamins are key ingredients that our body requires, but it cannot make itself. And hence we take it from the outside, either through diet or through supplements. But in this case of vitamin D, we get it from sunshine. Hence it's called the sunshine vitamin. Our skin produces vitamin D when it is exposed to sunshine. Now, vitamin D is involved in the calcium metabolism in the body, which means that when calcium metabolism gets affected, our bones can get affected. Hence, they can become thinner or weaker and then result in different sorts of signs and symptoms. In children, when the bones get thinner and weaker due to vitamin D deficiency, they can become softer. And then they can also bend and hence are called the bowed legs. The condition is called rickets. However, in adults, the thinning of these bones can cause bone pain in the thighs, in the buttocks, also in the lower back. And this condition is called osteomalacia in adults. Besides its role in bone metabolism, vitamin D might play a role in other parts of our health. This may play a role in fighting infections, keeping up our immunity strong so that we can fight infections away, in maintaining muscle strength, in making sure that we have better mood, so basically staving off any depression and low mood. There is some evidence being claimed that it can also help in fighting certain cancers. So it can play a role in different aspects of our body, but primarily its main function is to maintain calcium metabolism and hence helps us in keeping our bones strong and healthy. However, I must add that a consensus statement by organizations from UK, which are Dermatology Organization, National Heart Forum in UK, Diabetes UK, Cancer Research UK, Multiple Sclerosis, Osteoporosis Organization here in UK, they have issued a consensus statement saying that the role of vitamin D to prevent cancer, prevent heart disease, prevent diabetes, multiple sclerosis, and other chronic conditions, that evidence is not conclusive. So it should not be used as one vitamin which can save us from all these conditions. Also, additionally, we must remember that there is no consensus on what is the adequate level of vitamin D, which should be called as normal. It can be normal for different people, different levels can be normal. So we don't know which one is normal for vast majority. But Osteoporosis Society has clearly mentioned that anything less than 30 millimoles per liter is definitely can be classed as deficiency of vitamin D. Between 30 and 50 millimoles per liter, it can be adequate for some people, but for quite a few people, it can also be inadequate. But more than 50 millimoles per liter is definitely adequate level of vitamin D for almost all the population. So what causes a person's vitamin D levels to be low? It all depends on who you are, where you live, what gender you are, what kind of diseases you are having, and what kind of medication you are on, and what age group you fall in. Our skin produces vitamin D on its own when it's exposed to sunlight. Now, when we have less exposure to sunlight, for example, living in Northern Hemisphere, in places like UK, especially in the winter months from October to April, there is a steep rise in vitamin D deficiency because there is not enough sun. Depending on the color of the skin, dark-skinned people, for example, people of Southeast Asian origin or African origin, they have a very high propensity of vitamin D deficiency. In UK, Southeast Asian people, in adults, there might be a vitamin D deficiency seen in more than 90 to 94% of adults who are otherwise healthy. So that can be simply the reason why you have vitamin D deficiency. Other reasons being if there is any malabsorption in the intestines, because vitamin D is a fat soluble vitamin, which means that it needs to be absorbed from the intestine as other things. And if there is a disease like celiac disease, for example, where absorption is interfered with, then vitamin D deficiency can definitely occur. If you are an elderly person, in elderly 60 plus people, the vitamin D forming capacity of our skin also reduces. In men with COPD, there is a high chance of getting vitamin D deficiency. If somebody is on certain anti-epileptic medication, for example, carbamazepine, phenytoin, etc., there is a high chance that there can be vitamin D deficiency. Or if you are taking vitamin D, in that case, higher doses of this vitamin is needed. So there are these range of things in which can cause vitamin D deficiency. What are the signs and symptoms of vitamin D deficiency? Most of the times they're not even there. And when they are there, they might be very vague, as in one can feel tired, lethargic, there might be non-specific body pains, and hence, they're very easy to be ignored, and hence vitamin D deficiency is not easy thing to diagnose if we are not suspicious of it. It's only when the deficiency becomes severe that the more prominent signs and symptoms of bone pain or bowed legs they appear, and we can diagnose it. In babies, the severe vitamin D deficiency can result in fits or seizures that can result in muscle cramps in the babies. It can also cause some breathing issues or recurrent chest infections if the vitamin D deficiency is severe. And again, the mild to moderate deficiencies are very easy to miss. In children, severe vitamin D deficiency can cause softening of the skull bone, softening of the long bones of the leg, causing bow legs, muscle pain, and the child might be reluctant to start walking and finding it difficult to walk. This is what the condition, as mentioned earlier, is called rickets in children. They might also have delay in eruption of teeth. Teething problems can happen because of vitamin D deficiency. These children can also be more irritable. Their growth, especially the height part of the growth, might suffer because of severe vitamin D deficiency. In rare situations, when the vitamin D deficiency is very severe, it can affect the muscles which are required for respiration, breathing, and hence causing problems in breathing. Such children might need hospitalization. Recurrent infections can occur in these children. And lastly, if this deficiency is really severe in children, it can also affect the heart muscle, thus causing what we call it cardiomyopathy. And for all these severe situations, we have to need specialist care for these children. In adults, the signs and symptoms for vitamin D deficiency are, as I said, often vague. Tiredness, lethargy, crankiness, low mood, these can be the signs and symptoms. More severe deficiency can result in bone pain, muscle pain. Now, bones, they can also be hairline fractures. Bone pain or pressure in the bones can be felt in the rib cage, which is quite common seen in these patients. Bone pain can be in the thighs, in the buttocks, in the lower back. These can prevent you from, for example, getting off a low chair or walking up the stairs. These can be challenging. Again, depending on what age group are we talking about, these are the commonly seen symptoms in adults. How much vitamin D do I need, and how can I replenish it? As I mentioned earlier, vitamin D is the sunshine protein. But if there is no sunshine, then we are challenged to produce it through our skin. So especially for the months of March till October, most people, almost all people in UK are recommended to take 10 micrograms or 400 international units of vitamin D daily. There are other groups which are recommended the same dose, but throughout the year. These are the groups which need, for example, growth. For example, 1 to 4 year children, they are recommended to have this throughout the year. 10 micrograms, 400 international units of vitamin D. Pregnant and breastfeeding ladies need this dosage throughout the year. Elderly, more than 65 years of age, because elderly cannot produce adequate amounts from their skin, even if it is exposed to sunlight. Those people who are not exposed to sunlight, for example, they are indoors for long hours, or those who are housebound, or those who cover their skin, large part of their skin due to cultural reasons. All these groups do need a regular dose of 10 micrograms or 400 international units daily. Babies of less than 1 year, they are recommended 8.5 to 10 micrograms as vitamin D drops. If babies are fed on formula milk, then they are not needed any additional supplement, because all the formula milk, especially in UK, they are all fortified with vitamin D. In addition to supplements, natural ways of getting vitamin D is obviously from the sunshine. White skinned people, if expose their skin or forearms and face up to 20 to 30 minutes a day, that should be enough to replenish the stores. But of course, the sunshine is not there all year round. Dark-skinned people, especially in countries like UK, will need replenishment throughout the year with a dose of at least 10 micrograms or 400 international units daily. There are certain foods such as oily fish, trout, salmon, mackerel. These fish can help you increase the levels of vitamin D. Other foods as red meat or liver or cod liver oil, these can also help with increasing the levels. Some countries have milk which is fortified with vitamin D, and there are some other food products like cereals, etc., which are fortified with vitamin D. Just have a look at the packaging, and that will give you an indication. But these are the daily requirements. We can meet out with some of the natural resources too. What is the treatment for vitamin D deficiency? It will depend on what are the vitamin D levels. For example, if the vitamin D levels are below 30 millimoles per liter, then you definitely need a loading dose of vitamin D and then a maintenance dose of vitamin D. If they are between 30 and 50 millimoles per liter, you can do with the maintenance dose of vitamin D. But if they are more than 50, you don't need anything, reassurance, and then the maintenance of those levels by eating adequate diet, exposure to sunshine, and maybe take some fortified foods. Now, if they are below 30, as I mentioned, 30 millimoles per liter, vitamin D levels are below that, then you will need a loading dose, which is around 3,300,000 international units, which can be given over divided daily doses for over a week, or weekly dose, 6-week dose or a 5-week dose, depending on what strength of vitamin D is available locally. Once that is done, a month after, your calcium levels need to be checked to see if that has not gone through the roof, because as I said earlier, vitamin D impacts the calcium metabolism, and a loading dose of 300,000 international units can affect your calcium levels, which can go quite high up. Once the basic levels are in the range of 30 to 50 millimoles, one can have a maintenance dose of 800 units a day, perhaps. That can help. You would need to consult your doctor what would be the adequate level of maintenance dose or even the loading dose given your levels of vitamin D deficiency. There are certain disease conditions, for example, kidney diseases, some liver diseases, and some people on anti-resorption treatments for bone, which might need continuous vitamin D replacements. And again, it is the experts who are going to guide you through. So these are the basic treatment modalities which are available quite commonly all across the world. I hope through this video, I've managed to answer some of your questions. Vitamin D deficiency is a huge field on its own, and I'm sure there would be many more questions springing up in your mind. Please feel free to shoot those questions to me on my socials or leaving a comment under the video, and I'll try my best to get back to you. Take care.